My name is Alicia Palmer. I am a 24-year-old medical student in my 4th year at the University of South Dakota. The opportunity for this trip came up in October, and I had always had an interest in international medicine, and it just seemed like a really great opportunity to learn how physicians practice with limited resources, limited medications, and some critical thinking skills that I could use not only hopefully in international medicine in my career, but just a skill set that I could use even as I start residency next year.
If you put pharmacy buckets back on the other side.
Unpacking the buckets at our very first day of clinic was just kind of this overwhelming task because, we'd spent weeks before preparing these buckets and sorting all these medications. And so we'd gone through all this work to put everything into our buckets, but at least I personally hadn't really given any thought to actually using those buckets. And so then when the time came to unpack them, it was just this overwhelming, okay, where's this all going to go? And there were so many things that we still, wished that we had that we didn't really think about. It kind of gave you this, extra appreciation for American clinics where you just walk in the room and everything that you need is right there.
They thought, putting her in the fire would heal her.
It was kind of a difficult story to get. I think a lot was lost in translation. But essentially what we understood was that she had had a miscarriage, and their treatment for that was put her in the fire. So she came to us with keloid scars. There were also parts that hadn't healed yet. There was a little infection in some of those. I did my best to clean out those wounds, the debris and the pus, and get them clean. And then Dr. Bosworth kind of came over and pointed out that she kind of had some contractures on the back of her legs. What I learned from this burn victim is just how important honest, open communication is between a doctor and a patient, and how important it is to kind of put your own personal feelings aside when you're interviewing a patient, especially when it comes to things or behaviors that you may not condone yourself. Be open, to not judge, to not react negatively to what your patient is telling you. To put all those things aside and just focus on the patient, focus on the person in front of you, appreciate them, appreciate that they came to you so that you can ultimately treat them in the best way that you can. A trip like this provides an invaluable experience, and not only to learn how to treat patients with limited resources and how to think critically, but also a greater appreciation for the role that we have as physicians in taking care of people, and to see the great privilege that we have that people would come to us in their time of need and their time of suffering. How it came about that I was going to go into the mountains, we had already hiked probably an hour and a half up to a church, and we're going to set up a clinic to see patients that kind of came from their homes in the mountains to this church. And as we were setting up, Dr. Bosworth came over and said, "Would you like to go see a patient in their home?" And so, I was like, oh yeah, that would be great. And she's like, okay, we'll go get some supplies. And, I just kind of grabbed a few of everything that I could fit in my little fanny pack, headed up into the mountains, kind of with the impression that I was just going to go see one patient. Ended up being a lot more than one patient. It kind of turned into an entire day of just hiking up and down the mountains to these homes, getting the chance to see where people lived, the kind of conditions that they lived in. So one of the houses that we went to, the father in the house had cut his leg with a machete when he was out working to provide for the family, and had a cut on his leg. And it had become infected, and so I took care of that. And then I asked him what he'd been doing for it, and he said he was rubbing this salve on it. And so I asked, what the salve was or where it came from, and they brought me a little jar of the salve that they apparently use quite frequently in Haiti. And it has it's like an oily substance, and when you rub it, it gets warm, and so they kind of use that as pain relief. And so I asked them where they got it from, and they brought me a big leaf. Apparently there's a plant that grows, and they brought me the seeds for the plant, and that's where they get this salve. I told them that that's a really great pain reliever, but that they shouldn't be putting it in their wounds, and how, tried to emphasize how important it was to keep wounds as clean as possible. So it was interesting. And just had some really amazing opportunities to interact with people. Coming back from Haiti and thinking about all of the things that we saw, and we saw a lot of poverty, we saw a lot of disease, we saw a lot of what we would consider hopeless situations. But the people of Haiti they're just happy. We look at their living conditions and we look at their lifestyle, and we might think, like, how could anybody ever be happy living like that? They have 100 more reasons to complain than almost anyone here does, and yet they are just so joyful and so life-filled, and it's just, I think, an amazing learning opportunity for us to, really focus on all the things that we have and how blessed we are, and to be joyful and to just appreciate that. Where I remember seeing joy come alive in, a real visible, tangible capacity was when we were the night before we left the orphanage, and all of the kids came out and sang Amen, Alleluia, the song to Dr. Bosworth, because it's one of her favorite songs. And there were probably, 50 plus people there. And so, just seeing all these people sing this song with just such vibrance and exuberance, and everybody from, the youngest kids and the teenagers and the adults were all just, really singing from the heart and jumping up and down, and, it was just really, an awesome thing to be able to experience. Makes me appreciate that, how important, the attitude that you take towards life is.